my name is Dr. Andi Pusavat, and I am a faculty member here at the University of Denver in the Counseling Psychology program, and I'm also the training clinic director.
Hi, I'm Trish Rocky-Bogdan. I'm an assistant professor in the Department of Counseling Psychology here at the University of Denver.
Well, initially, a lot of people have kind of a shock and overwhelm reaction, and it's important to note that they might have a wide range of intense emotions when they first are diagnosed, and things that people experience oftentimes are depression, anxiety, isolation. They may also experience a change in their relationships, and it's important that they think about seeking help and really connecting with other folks around that diagnosis and kind of the effects that it's having on their life.
I think you put it well. Yeah, I think it can affect just life roles and really that sense of purpose and meaning in life, and how to make sense of the diagnosis and what it can mean for someone's future. So I think to begin with the cancer care treatment team, and so bringing in any mental health concerns or just describing how their mood is. Part of cancer care teams are also now starting to do distress screening as part of their regular treatment. So it's meant to be built in to ongoing cancer care to identify folks who have mental health concerns. At the same time, there's lots of support groups out there, again, often within cancer centers, but then there's also advocacy and cancer-focused or nonprofit organizations that often have groups, whether that be in-person or online resources. Sometimes there's sports-related groups also that are for cancer survivors specifically. Right. So lots of ways to connect with peers as well as mental health professionals, and then also oncology providers more directly.
Mm-hmm. I think it's important to find community, and people experience healing in many different ways, and so for some people it's really helpful to seek support in their faith communities, in the communities that they already had and within their family and friends. And I think in terms of resources, there's a lot online, but there's also a lot that is done even in person, like at walks and things like that. So a lot of resources can be found at different breast cancer awareness and survivor walks. I think really they should be looking for how the person is functioning, and things like, are they eating, are they sleeping, are they engaging in activities that they used to enjoy, are they able to kind of breathe and function throughout the day, and are they able to engage in their care in ways that are helpful to themselves? So are they compliant with their treatment? Are they attending appointments? And are they able to care for themselves in ways that maybe they had always kind of been used to doing? So that's including exercising and eating healthy and things like that.
And I just add, we know social support is so important, and so creating space to have authentic, honest conversations about reactions to cancer, and not necessarily always rushing in to fix it, mm-hmm. but just honoring where someone is, and both, I think, knowing that people can be experiencing grief and at the same time be practicing gratitude or be practicing finding good in their cancer experience. It's not one or the other. So creating relationships that create space for that sort of dialogue and communication about the experience, I think, is really important. It doesn't look just one way, mm-hmm. and so that part of really, I think, just practicing mindfulness and self-compassion throughout the experience, and trying to let go of any sort of self-judgment about being a good survivor.
Right. I think finding what works for each person is going to be a unique experience, and that kind of formula of what works for them at one point, and then staying open to how that will change, and maybe the need for resources or different coping skills will change over time, and then honoring, as you said, where they're at and kind of what they need.